Health for Life. This is the first ever medical show on television that deals with prevalent health problems and concerns, and they do so in an easy to listen to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
We'll come to the surgical treatments just now, but when you talked about it lowering their blood pressure, a question came up here. For the patients who have high blood pressure and enlargement of the prostate, these are not similar medicines. There's not as if they're going to take one medicine that's going to lower their blood pressure and it's going to work on their prostate also, or is it two separate medications?
Because it can lower the blood pressure, we speak mostly of the alpha blockers, and I guess the most common one will probably be doxazocin, is that when they're prescribed this medication, your patient needs to, of course, tell whoever's prescribing the medication that they have this condition and they're on whatever other meds they're on. That doctor will take it into consideration when prescribing an alpha blocker. Sometimes it can be used to substitute, but that is not something to be decided by the discretion of your viewer or the patients.
Correct.
It's something that needs to be discussed with your doctor.
So please discuss that with your doctor. And if you have problems with your prostate and you also have high blood pressure and you're taking high blood pressure medicines, extremely important that you mention that to your doctor. We're going to come back after the break and talk about the surgeries, but let's preface that by talking about which are the candidates that you might decide we're going straight to surgery, and which are the candidates that, having failed, you say, okay, which of the options? So who goes straight to surgery?
So generally speaking, there are a few patients that we can immediately identify as good candidates for surgery. Those are men that, because their prostate is so large and so bothersome that they presented with urinary retention, so unable to pass urine and need to be catheterized. There are men who we expect will not do well on medication, usually based on the size of their gland or the significance or severity of their symptoms. So those that are severely symptomatic with very large glands are very likely to benefit most from surgery and would not usually do well on just medication.
To summarize again, the prostate is a gland in men. It gets enlarged because the tube, the urethra that passes from the bladder out, this prostate surrounds it, it causes obstructive symptoms. So Dr. Prasad, two procedures generally utilized to manage benign prostatic hypertrophy in Guyana. Those two procedures are both available. Let's talk about them.
Yes, and these, just to remind your viewers, these are surgeries or surgical options that we're speaking of. One of the most common ones is something called a TURP, T-U-R-P, which stands for transurethral resection of the prostate. If you imagine the prostate to be kind of like an apple in its enlarged state, the aim of this procedure is to insert an instrument through the penis and basically shave away at the core of this apple, therefore opening up the channel so that the urine can more freely pass from the bladder out through the penis.
Right. So this procedure, in terms of the preparation for this procedure, the patients have a choice of anesthesia?
Right, so anesthesia, when it comes to this procedure, can be mainly one of two types. General anesthesia, where the patient is asleep, and the body is completely relaxed and they're placed on a machine to help them breathe. And then there's spinal anesthesia, where the patient can be awake, but they're basically anesthetized or numb from the waist down, so they don't experience any discomfort. It's individualized again, and this is a conversation that the patient will have with their surgeon and their anesthetist, and they can decide what is safest for them.
So this procedure, like you said, is done where an instrument is passed through the penis and it's shaving out the center of this apple. What's the usual time frame for the surgery, and are there any tubes or special things left in the patient after surgery?
Generally speaking, a TURP will probably last about 1 hour in terms of the actual surgery being done. Most patients can expect that after the procedure they will have a tube, which is called a catheter, placed through the penis into the bladder, and this tube will be left there for a few days. It will then be removed, and we observe to see how the patient passes urine.
And as a general rule, how long will they be in the hospital?
Hospitalization, again, very individualized, under the best of circumstances. Usually one night, and patient can go home the next day. If they're, for whatever reasons, more complex cases, the patient has a lot of comorbidities, not necessarily related to their prostate, they may be asked to stay longer.
Okay. Now let's talk about the open prostatectomy. Again, the same questions: type of anesthesia, duration of surgery, expected length of stay, and more importantly, why we would go with the open prostatectomy as opposed to the TURP.
Right. Anesthetic options remain the same. Either be put fully to sleep or spinal options in the open prostatectomy. Open prostate, so you may wonder if we can do this without cutting, because the first option, the TURP, I should specify, there's really no skin incision, so there's no obvious cut in the belly. You might be wondering, well then, why don't we do them all this way? Well, sometimes we can't, and the reason we can't is because the gland can sometimes be so large that it's very difficult to resect all of it in an endoscopic manner. And so usually an open procedure is reserved for men with very large prostates, or those with bladder stones or other complications of an enlarged prostate. It can take a bit longer, usually maybe an hour and a half to 2 hours. And complication rates are about the same, slightly higher risk of bleeding because it is a larger gland and infections. Length of stay in hospitals can generally be a bit longer because it's far more invasive procedure. And one of the benefits, as you know, of endoscopic or minimally invasive surgery is they can get home a lot faster. This is usually not the case here.
Now, a question that many of our patients always ask us when they're going to have any surgery procedure is the requirement for blood.
Prostate surgery, whether it's a minimally invasive endoscopic surgery or it's an open procedure, is associated with potentially significant blood loss. And so patients undergoing prostate surgery, we usually group and cross-match them or type and screen them, meaning we usually have blood available should transfusions be necessary. A lot of the times it's not necessary, but it's always safe to have blood available when we're doing these procedures.
Well, viewers and listeners, that brings us to the end of our program today. Dr. Chris Prashad, thank you very, very much.
Happy to be here.
And we have been talking about benign prostatic hypertrophy, or BPH, or prostate enlargement. Thank you very, very much. And like we mentioned, we will be discussing prostate cancer in one of our future programs. Thank you very much. Have a good evening and a pleasant remaining part of the weekend.